The Our Father Prayer. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. Amen.
Hello everyone, I'm Jasmine Trevina together with Mr. Kenneth Miguel, Miss Tanya Nicole Monelia, Miss Nicole Rabanal, Miss Joanne Cristobal, Miss Christine Torrebranca, and Miss Giselle Priolo.
This is a short review in our present lesson to give you an idea what our lesson is all about. I'll show you some pictures. We have A, B, C, D, E, F, G, H, I, J, and K. We have a lot of pictures. How would you describe the nails in the pictures? Can anyone answer my question? Very well said. Those pictures are example of nail diseases and disorder. Next question. What do you think are the causes of damage to nails? Anyone? Raise your hand if you know the answer. Oh, okay, very good. Do you have any idea how to prevent this? Again, anyone in the class? Okay, since you don't have any idea about how to prevent the nail diseases, nail fungal infections is typically don't go away on their own. And the best treatment to this is usually prescription antifungal pills taken by mouth.
Now class, I've brought some pictures with me, and I want you to tell me what you see. What part of your hand is coarse sensitive to dirt? Is it your palm or your fingernails? Do you think it is important that we take care of our fingernails? Why? How do you say so? Very well said. And now, how do you take care of your fingernails? What else? Another idea? That's right, class.
Okay class, our fingernails are more sensitive in dirt. We need to take care of our fingernails to prevent nail infections. We take care of our fingernails by washing it with soap and water, and by cleaning and doing proper nail care.
So at the end of the lesson, the student should be able to, number 1, enumerate the various diseases and disorders of the nails, and number 2, identify the different nail diseases, and number 3, explain the various diseases and disorders of the nails. So I have a picture here. So based on the picture, what do you think will be our lesson for today? Yes, very good. So our topic for today is all about the nail diseases and disorders and the causes and prevention for it. So class, what do you know about this topic? Anyone? Yes, very good. There are various types of nails diseases, and if we don't take care of our nails, there is a possibility that we can get this kind of diseases and disorders.
Different nail diseases and disorders.
We have the paronychia. Paronychia is an infection of the skin around the fingernail or toenail. The infected area can become swollen, red, and painful, and this pus-filled blister may form. Most of the time, paronychia is not serious and can be treated at home. Paronychia usually results from bacteria. Bacteria get into the skin through cuts in the cuticle and the nail fold. Most of nail infections or the paronychia get better with antibiotics. Next is Pseudomonas. Pseudomonas, often referred as the greenies in the nail salons, is a common bacteria that can cause infections that range from minor to life-threatening. In those patients who have a weakened immune system, such as burn victims or newborns, Pseudomonas can be very serious. Pseudomonas infections of the nails are treated by fluoroquinolones when necessary, in comparisons with other bacterial nail infections that require culture and sensitivity testing. Next is fungal infection of the nail plate. Most fungal nail infections are not serious. However, some people may experience pain or be bothered by the appearance of their nails. Fungal nail infections may cause nails to become discolored, thick, fragile, or cracked. The nail may also become separated from the nail bed. Traditionally, oral antifungal treatments have been used to treat the fungus, although they can be accompanied by side effects and drug interactions. Terbinafine and itraconazole are the two medicines mostly commonly prescribed for fungal nail infections. These usually need to be taken once or twice a day for several months to ensure the infections has completely cleared up. If you stop taking the medication too early, the infections may return. Next, we have the ringworm. Tinea unguium or onychomycosis is the chronic fungal infections of the nails. It is normally caused by the dermatophyte fungus. The nails grow very thick and turn white or yellow. Treatment is by antifungal drugs taken as tablets.
Nail atrophy or onychotrophia is an atrophy or wasting away of the nail plate which causes it to lose its luster, become smaller, and sometimes shed entirely. Injury or disease may account for this irregularity. Causes of nail atrophy. Trauma damage is by far the most common cause of atrophy of the nail. A client who hits her hand with a hammer or slams her finger in a car door often causes injury to the nail matrix, which is the growth center of the nail. Treatment or cure. Treatment includes peeling or buffing of the nails, oral biotin supplements, Oreo nail preparations, and triamcinolone injections into the nail matrix. Prevention for nail atrophy. Avoid hitting, running, and bumping our nails with hard objects. Ingrown toenail or onychogryposis are claw-type nails that are characterized by a thickened nail plate and are often the result of trauma. Causes of ingrown toenail: wearing shoes that crowd the toenails, cutting toenails too short or not straight across, injuring a toenail, having very curved toenails, nail infections, and certain medical conditions. Treatment or cure for ingrown toenails. You can treat most ingrown toenails at home. Here's how. Soak your feet in warm soapy water. Do this for 10 to 20 minutes, 3 to 4 times a day until the toe improves. Place cotton or dental floss under your toenail. After its soaking, put fresh bits of cotton or wax dental floss under the ingrown edge. This will help the nail grow above the skin edge. Apply petroleum jelly like Vaseline on the tender area and bandage the toe. Choose sensible footwear, considering wearing a open-toed shoes or sandals until your toe feels better. And take pain relievers. Prevention for ingrown toenails. Trim your toenails straight across. Keep toenails at a moderate length. Wear shoes that fit properly. Wear protective footwear and always check your feet. Psoriasis of the nails is characterized by a raw scaly skin and is sometimes confused with eczema. When it attacks the nail plate, it will leave it pitted, dry, and it will often crumble. Causes of psoriasis. Nail psoriasis is caused by the same autoimmune mechanisms as skin psoriasis. For reasons not entirely clear, the immune system will inexplicably regard normal tissues as harmful and launch an immune assault. Although the skin is the primary target, other tissues are affected as well. Treatment: home remedies like aloe vera, Dead Sea salt, and turmeric. Prevention for psoriasis in nails. Wash your hands and nails regularly to prevent an infection. Moisturize your nails and the skin around your nails. Keep your nails trimmed short. Apply nail hardener polish. Cut off hangnails. And wear gloves when doing activities that may damage or dry out your nails or the skin around your nails, like washing the dishes, playing sports, or working outside.
Onychorosis is a condition that causes a vertical ridges to form on the fingernails. Instead of relatively smooth the nail finger or the nail plate, a person with this onychorosis will have a grooves or ridges in their nails. Some people may have this condition on only one nail, while others will have on it all nails. So the causes of this onychorosis is believed to be a result of disordered keratinize in the nail matrix, and it's due to variety of conditions, normal aging, physical factors, repetitive trauma, and frequently soap and water exposure. The treatment of onychorosis based on my research is first, taking a folic acid. Second is taking a biotin. Third is taking a multivitamin. Fourth is specific nail medications. And last, applying a formal hydrating or varnish. So next is onychosis. What is onychosis? Onychosis is a medical term. So next is onychosis. What is onychosis? Onychosis is the medical term for an overgrowth of thickening of the nail, which can be discolored, turning into white, yellow, red, or black. Red or black nails are often a result of dry blood underneath the nail plate. However, it is important to check it out as it can be melanoma. So next is the causes of onychosis. It can be caused by something as memorable blunt or trauma. From example of this is the tie shoes. However, onychosis can be also caused from more serious issues that affect the nail bed and skin. The treatment of onychosis is first, trim the nails carefully. Second, feet can be soaked in a bowl of water with 3/4 tablespoons of cider vinegar and 3 times a week to soften the nail before buffing to remove the low layer. Third, the thickened nails may need to be reduced by a chiropodist if you are unable to do it yourself. Last, palliative care and essential. You have to know the proper taking care of the nails. Next is deloconychia. What is deloconychia? Leukonychia, or a white nails, is usually not an alarming sign, but it can sometimes unmask serve systematic disorder or congenital conditions of the nails. The white color can be due to nail plate or nail bed abnormalities. So next one is leukonychia. What is leukonychia? Leukonychia is a white nails. Is usually not an alarming sign, but it can sometimes and must deserve systematic order of congenital conditions of the nails. The white color can be due to nail plate or nail bed abnormalities. The causes of leukonychia, the most common cause of this white nail spots called leukonychia. It's an injury to the nail matrix. These injuries can occur if you pinch or strike your nails or fingers. So what is the treatment of leukonychia? If the leukonychia is caused by fungal infection, then use antifungal medication. Topic. So the treatment of leukonychia, if the leukonychia is caused by fungal infection, then the use of an antifungal medication, topically or orally, can be used to treat it. Leukonychia can also be buffed away with use of topical antifungal or nail solution.
Good day everyone, I'm Christine M. Franca. So let's proceed to the next. This is called views lines. So views lines are nails that are characterized by horizontal lines of darkened cells and linear depressions. So kung makikita natin sa pictures, parang nauuka or nade-deform yung pinaka-nail plate niya. So parang may panibagong patubo, tapos hindi na ganun kaganda yung nagiging itsura ng pinaka-nail niya. So the grooves run horizontally across the nail plate that usually develop when the nail plate growth, which begins in the nail matrix. So ano nga ba yung mga causes ng disorder na to? So this disorder may be caused by trauma, illness, malnutrition, or any major metabolic condition, chemotherapy, or other damaging event, and that is result of any interruption in the protein formation of the nail plate. So these are the treatment or cure that we need. So we need to apply creams or moisturizers for eczema or psoriasis. So paano nga ba natin ito mape-prevent? So we need to avoid manicures, artificial nails, or harsh nail products, and we need to keep our blood sugar under control if you have a diabetes. So let's proceed to next. This is called coloonychia. So this is an intended nails. Instead of growing straight, your nails look concave like spoon. So parang siyang kutsara, no? Parang tumitiklop yung gilid niya and nagka-curve siya na like spoon. So ano nga ba yung nagiging cause nito? This is usually caused through iron deficiency anemia, and these nails show raised ridges and are thin and concave. So these are the treatment and cure. So the treatment will depend on the cause of coloonychia. So some causes will respond to dietary changes. So consuming enough iron in the diet can also help prevent unwanted nail changes. So these are the prevention. We need to prevent wearing rubber gloves when washing up or using cleaning products. We need to use a soft nail brush to keep the nails clean. So we need to apply hand cream also to nails to moisturize them, and trimming the nails after a bath or shower when they are soaked, and keeping the nails short and trimming toenails straight across the top, and ano pa ba? Choosing footwear that does not cramp the toes and nails. So next, let's proceed to melanonychia. So this is a vertical pigmented bands often described as nail moles, which usually form in the nail matrix. So it could signify malignant melanoma or lesion. So dark streaks may be normal occurrence in dark-skinned individuals and are fairly common. So common lang daw to sa mga moreno, ganon, na para siyang nagkaka-straight line, na parang siyang lunal, ano. So ano nga ba yung nagiging cause nito? So this is caused when the pigment cells called melanocytes deposits melanin brown colored pigment into the nail. So, ano pa ba yung mga other causes? Pwede rin yung may mga some bacteria, or kapag may mga fissure, you use tobacco or nag-smoke ka, pwede kang makakuha ng ganitong sakit. So, pwede rin sa mga hair dye and sa mga henna. Pwede natin makuha yung sakit na to. So, ano nga ba yung mga treatment and cure? So, the treatment of this disease varies depending on the cause. So, if your melanoma has a benign cause and is non-cancerous, there's often no treatment needed. So, pero may ibang treatment din na options depend on the cause, and like taking antibiotic or antifungal medications if the cause is infection, and pwede rin yung treating the underlying disease or medical condition causing the melanoma. So, paano nga ba natin ma-prevent itong disease ito? So, we need to eat healthy foods, so avoid taking drugs, and treatment of any contributing skin disease. So, that's all. Thank you.
Good day everyone, I am Nicole Kate Sirebanal and I'm going to discuss the next disease, which is Pterygium inversum unguis or PIU. What causes Pterygium inversum unguis? It is an acquired condition characterized by a forward growth of the hyponychium, characterized by leaf tissue firmly attached to the underside of the nail plate, which contains a blood supply and nerves. Possible causes are systemic, hereditary, or from an allergic reaction to acrylics or solvents. The treatment of PIU, a most effective strategy is the treatment of the underlying causes of PIU. Patients with PIU need to be evaluated to rule out associated rheumatologic diseases and required long-term follow-up examination to detect the development of connective tissue diseases such as scleroderma. How we can prevent PIU? Never use force to push back the advancing hyponychium. It is an extremely painful approach and will result in a blood flow. Consult a physician for diagnosis and treatment.
So now, let's proceed to the next nail diseases and disorder. Brittle nails or splitting layers or peeling layers. Brittle nails are characterized by a vertical splitting or separation of the nail plate layers at the distal free edge of the nail plate. In most cases, nail splitting and vertical rigor are characteristics of the natural aging process. Causes of brittle nails: too little moisture and repeated washing and drying of fingernails. The treatments are applying nail hardener, moisturizing, and wearing a gloves. The next one is vertical ridges. Vertical ridges are also characteristics of aging, although are not limited to the age or elderly. The nail plate grows forward on the nail bed in a rail and groove effect, much like a train rides on its tracks. The causes are ranging from stress to kidney and thyroid disease. And the treatments are moisturize your nails regularly, buff them gently, Don't mess with your cuticle and consider taking a biotin supplement.
Hematoma. A hematoma is the result of trauma to the nail plate. So it can happen from simply trapping your finger or toe in the car door, to friction from improperly fitting or too tight shoes, to sports-related injury. So the causes of hematoma is a subungual hematoma is usually the result of some kind of the injury to the blood vessels under the nail bed. So for example, the blood vessels can break and leak blood into the area underneath the nail when a door slams on a finger or a heavy object crushes a toe. So a treatment or cure in a hematoma is a doctor may perform a procedure called nail trephination to drain the blood from under the nail. So this can help to relieve the pain and pressure. The doctor will make a small hole in the nail with a laser or needle. So afterward, the area may be wrapped with a bandage and may continue to drain for up to 3 days. So a doctor may perform nail trephination to drain the blood and help to alleviate pain and pressure. So a minor subungual hematoma does not cause serious health problems. Home remedies can help to manage the pain while the injury heals. So the nail patella syndrome is a rare inherited disorder characterized by the abnormalities of bones, joints, fingernails, and toenails, and kidneys. So diagnosis is clinical. There is no specific treatment, but inhibitors may be given for proteinuria and hypertension, and kidney transplantation is sometimes done. So the nail patella syndrome is usually caused by a fault in a gene called LMX1B that inherited from one parent, but there is not always a family history of nail patella syndrome. In some cases, an LMX1B gene mutation or alteration occurs for the first time on its own. So for the treatment, there is no specific treatment for nail patella syndrome, but proteinuria and hypertension can be treated with ACE inhibitors.
Question number 1. Have you ever experienced nail disease and disorder? Number 2. What causes you to have nail disease and disorder? Number 3. What nail diseases and disorder have you experienced? And how did you cure it?
Now for your activity, you will group yourselves into 6 groups. Each group have one representative to describe and identify what is on the pictures. A student who answered it correctly will get a 5 points and 3 points for those who tried. Understand, class? So these are the pictures.
Another questions? Number 1, what do you think are the nail diseases and disorders that you often see or commonly experienced by people in your barangay? And number 2, how many people do you think you have seen in your barangay with nail disease and disorder?
After learning the different nail diseases and disorders, we will have an activity class. So these are the questions. In enumeration part, the number 1 is list down at least 6 nail diseases and disorders. In essay part, number 1, why do we need to take care of our nails? And number 2, in your own words, define nail diseases and disorders.
And for your assignment, make a video presentation interviewing 5 people with nail disease and disorder. Ask them what nail disease and disorder do they have, where did they get that, and how do they treat or cure it. The deadline of submission is until next week, Friday. And for the closure, I have here 3 questions. First, what you have learned in today's lesson. Second, what have you discovered? And third, how are you going to apply this learning in your everyday activities?